I will soon hand over to our regional director, Dr. Hans Kluge. But first, please allow me to introduce our panelists who are also here to take your questions. Joining us here in the studio are Dr. Catherine Smallwood, Senior Emergency Officer, who is coordinating our response to COVID-19. Joining her on set as well is Dr. Natasha Adzobardi-Muscat. She is the director of our Division for Country Health Policies and Systems. And joining us online is Dr. Siddhartha Datta. He is the Regional Advisor on Vaccine-Preventable Diseases and Immunization. So, without further ado, let me hand it over to Dr. Hans Kluge. Hans.
Thank you for joining us. Science, surveillance, responsibility. 3 words that encapsulate my 3 main messages to the WHO European region today amid the latest developments in the COVID-19 narrative. First, going with the science. From the information available to WHO, the SARS-CoV-2 virus variants circulating in China are those that have already been seen in Europe and elsewhere. We share the current view of the European Centre for Disease Control, ECDC, that the ongoing surge in China is not anticipated to significantly impact the COVID-19 epidemiological situation in the WHO European region at this time. But we cannot be complacent. While we acknowledge that China has been sharing virus sequencing information, we need detailed and regular information, especially on local epidemiology and variants to better ascertain the evolving situation. It is not unreasonable for countries to take precautionary measures to protect their populations while we are waiting more detailed information that is shared via publicly accessible databases. For those countries in our region introducing precautionary travel measures at this time, we are calling for such to be rooted in science, to be proportionate and non-discriminatory. That brings me to my second message, surveillance. Over the past year, many countries in our region have greatly reduced their surveillance capacity for COVID-19. In the first 5 weeks of 2022, variant information on 1.2 million cases was submitted as part of weekly surveillance data to WHO and our partner, the ECDC. However, this declined to about 90,000 cases in the last 5 weeks of the year. We commend European countries that have maintained strong genomic surveillance, including Denmark, France, Germany and the United Kingdom. Indeed, recent data from some of these countries are starting to indicate the growing presence of the new XBB.1.5 recombinant virus that has already been spreading rapidly across the United States. XBB.1.5 variant cases in our region are being picked up in small but growing numbers, and we are working to assess its potential impact. After 3 long pandemic years, with many countries grappling with overstretched health systems, shortages in essential medicines, and an exhausted health workforce, we cannot afford more pressures on our health systems. Such a threat could come from a new variant of concern anywhere, anytime, including right here in Europe and Central Asia. Building upon the lessons learned, we must be able to anticipate, detect and respond in time. And this is true not only for SARS-CoV-2 but any emerging health threat. Hence my third message for today, responsibility, on the part of governments and the general public alike. Entering 2023, countries across Europe and Central Asia need to redouble their efforts to implement proven effective strategies and avoid being complacent. This means urgently reinvesting in and recommitting to enhanced virological and genomic surveillance, including wastewater surveillance as feasible. This means investing in and safeguarding the health workforce, whose precarious situation in many places could undermine the effective provision of health services. This means continuing the 5 pandemic stabilizers that have proven so effective, increasing vaccine uptake in the general population, administering additional vaccine doses to priority groups, promoting mask wearing indoors and in public transportation, ventilating crowded and public spaces such as schools, bars and restaurants, open space offices and public transportation, and providing early and appropriate therapeutics to patients at risk of severe disease. Further, as we have seen, these measures can also reduce the impact of other respiratory infections, in particular influenza, that our health services are struggling with at this time. Science, surveillance, responsibility. All of these must come together all the more as we enter the 4th year of the pandemic to ensure a future for all. Thank you.
Thank you so much, Hans. Now we will go straight to the Q&A. We had some questions come in slightly ahead of time, and we've got the Xinhua Chinese News Agency and David Williams, who is also online. David, would you like to ask your question yourself, or I can certainly ask it for you? Well, since you don't have your hand raised, let me just ask it for you. What is the World Health Organization's position regarding the use of entry restrictions, including testing, vaccines on travelers from China at this time entering this part of the world? Hans, over to you.
Thank you. So, scientifically, there is no immediate threat for the European region at this point in time, based on the information we have from China, because the variants which are circulating in China are those also circulating in Europe. However, it is important to keep public health confidence by the population. So, as I was mentioning in the statement, we do acknowledge that a number of countries, based on the precautionary principle, are implementing some measures while we anticipate more information to be shared available at public databases. But it's very important that those measures, those precautionary measures, are based on science, are proportionate, and particularly are non-discriminatory. I was mentioning about the XBB.1.5 variant, which is now dominant in the United States, which also is showing up in our region. And this underscores the importance that we cannot enter 2023 blind in our own region. Thank you.
Thank you so much, Hans. We have a couple of hands over here. Natalie Grover, please, over to you. Can you turn on your camera? Thank you.
Is it okay if I don't?
Sure.
I'm just sitting at home in my pajamas. Thanks very much for taking the questions. Could you comment a little bit on the drug shortage situation across Europe? You know, we've been hearing about this for a while now. Obviously, there's been an uptick in demand due to sort of the bacterial infection cases, but we're also being told that there's a long-standing supply problem. What do you expect health systems should be doing to deal with to address the problem, because it doesn't seem to be going away?
Thank you so much for that. I think that would be for Dr. Atto Pradi-Muscat.
Thank you for that question. And indeed, medicines shortages is an important problem that we have at the moment. Let me start by saying that this is not new. Medicines shortages was already on the agenda even before the COVID pandemic, but we know that during the COVID pandemic, some disruptions have taken place. And at the moment, in fact, many countries are facing acute stockouts of certain important medicines. This continues to have an impact on patients and on health workers too. My main message for the general population and for patients is to seek help and to ask advice for alternatives that could be made available wherever possible. And secondly, also not to hoard. This is a message both for individuals, households, and also countries. As limited supplies become available in a period of shortage, sometimes there is a tendency to hoard, but this then only makes the problem worse. At this time, of course, we also are empathic to the fact that this places additional strain and workload on pharmacists, doctors, and other health professionals. As the WHO European region, we have been calling for governments and industries to work more closely together to understand and anticipate the problems with sourcing, production, and supply chains and logistics, not only for novel and expensive medicines, but also for the mainstay medicines, which are still very important in our health systems. And we do understand from the industry that when it comes to these medicines, some problems are being faced both in the production of the active ingredients as well as ensuring that there are enough and sufficient manufacturing facilities to have the products online. We also are aware that steps are being taken to try and redress the shortages, but it may be a matter of a few difficult weeks ahead until this is resolved. Thank you.
Thank you so much for that. The next question comes from Donato Mancini of the Financial Times. Donato, over to you.
Hi, good morning. Thanks for taking my question. I have two, actually. So, given XBB.1.5 is surging in the US, shouldn't travel checks be implemented for people traveling from there, given the precautionary principle makes sense? And just to get a straight answer on this, do you think China is a WHO assessment on the situation in China that China is lying on case numbers, hospitalizations, and deaths? Thank you.
For the first question, why don't I turn to Dr. Smallwood?
Thank you very much, Donato, for the question. And when it comes to XBB.1.5, which is a recombinant virus that has been spreading very, very rapidly in northern US and eastern parts of the USA, our primary recommendation at this stage is that countries within Europe should have really good genomic surveillance systems that are able to pick up cases that emerge in the European region and are able to assess the variant and how it is spreading and its particular characteristics given the specific system and context here in the European region, which may be different from the context in the Americas. In terms of travel measures, yes, our opinion is that travel measures should be implemented in a non-discriminatory manner. That's not to say that we recommend testing of passengers coming from the US at this stage. Countries need to look at the evidence base for testing, pre-departure testing. When it comes to other measures, things like mask wearing on long-haul flights, WHO's recommendation is that passengers should opt to wear a mask in high-risk settings, such as long-haul flights, and this should be a recommendation issued to passengers arriving from anywhere where there's widespread COVID-19 transmission. And pretty much that's across the European region, that's across the Americas, and more or less across the world. So we shouldn't be targeting any particular passengers by themselves. In addition to that, there's some other measures that many countries or groupings of countries have taken, such as looking at genomic surveillance specifically targeted at passengers arriving from other countries. That can be done, but it should not divert resources away from the domestic surveillance systems that are really looking at our populations here. We're also recommending wastewater monitoring systems that can look at wastewater around points of entry such as airports. But again, this should be looking at passengers arriving from all destinations. We should not be blindsided at any point by an exclusive focus on one particular geographic area.
Thank you so much for that, Dr. Kluge, for the question on China specifically.
Yes, there has been several interactions, continue to be several interactions at the three levels of the organization of WHO, the country office, the regional office of the West Pacific, and WHO headquarters. Particularly, quite some information has been shared on the genomic sequencing. And as our Director General, Dr. Tedros, was calling upon continued and increasing information on hospitalizations, ICU admissions, streamlining of case definitions on mortality, we anticipate that more information is going to be shared, which then will further increase the confidence by the population in the region and measures to be adapted.
Thank you so much for that. And we have a question now from Sarah Taisir Ben Sharif. Please, over to you. And which organization are you from? Thank you.
I am Sarah Taisir Ben Sharif from Politico Europe in Brussels. My question is perhaps a bit of a semantic one, but I'm just wondering, as I understand it, XBB.1.5 is a recombinant of Omicron strains, but I'm just wondering at what point do you give it a new name? So it's a question about the nomenclature. Is XBB.1.5 sufficiently different that we can give it a new name? People in media have been calling it the Kraken variant, but I'm just wondering who give it its own, I guess, scientific official name. Thank you.
I think
and if so, what is it?
Sure. Thank you. I think that's for Dr. Smallwood.
Yeah, thank you very much, Sarah. We have at WHO in our emergencies program a technical advisory group on virus evolution that's looking precisely at these issues, not just for the XBB sublineages, but also for any new sublineages or variants of SARS-CoV-2 that are emerging and spreading. And at this particular time, they're looking very, very closely at the sublineage XBB 1.5 in order to determine whether or not this would represent a new variant of concern or continue to be designated as an Omicron variant of concern. We look at several things. One is the antigenic distance, or the distance, evolutionary distance away from other circulating variants and viruses. And second is the specific characteristics of that variant and of the virus. And for that, we need information both on the virology, but also on the epidemiology linked to the spread of this particular virus. And at this stage, we've seen it spread very quickly in the USA. We need to understand what basis that spread is linked to, whether it's a higher growth advantage due to transmission, to the binding to the human receptors, whether it's immune evasion, and all of these studies are ongoing at the moment. And we also need to pick up these characteristics in other settings where potentially the population immunological profiles might be different. And so for that reason, we need to reinforce our ability to pick up the cases here in Europe, where we know that it's already spreading at small numbers at the moment, but increasing. And we need to very rapidly link the data we have on the emergence and spread of this variant to the epidemiologic data to understand what potential public health impact it will have. And then we'll be able to make a determination on whether this constitutes a new variant of concern that deserves its own name.
Thank you so much for that, Dr. Smallwood. We have a question on vaccination, and this comes from Irina Dergacheva of the TASS news agency. And this is for, I think, Dr. Datta. It says, in Denmark, the health authorities think that the population is already, quote, immune to coronavirus, and they do not recommend more vaccination, though now more and more people are getting sick. However, in Sweden, experts seem to say the more the better. Who is right? Over to you.
Thank you so much, Roy. Thank you, Irena, for asking that question. I think, first of all, I think we need to thank both Denmark and Sweden for offering the benefit of this COVID-19 vaccine to its population. And I think the population also have shown huge amount of confidence and trust in the government, and also the information that was made available to them on the benefits of using a COVID-19 vaccine. Both of this trust, both from the government to offer the vaccine to its population and for the population's trust on the government's decision, is reflected on the high vaccination uptake, both for complete dose cities and now on to the first booster dose coverage that we have seen both in Denmark and as well as in Sweden. Having said that, any decision being made in a country on the number of doses, the vaccine to be used, are determined by the National Technical Advisory Group of experts who review the local epidemiological situation, which are the age groups that are being affected, and thereafter they make the prioritization of the population groups in a country. And this, I think, is a standard process, which was also being used both in Denmark and Sweden. It's not a matter of who is correct and who is wrong. It's a matter of what is the local disease epidemiology in a country and the decision-making process. Just also wanted to highlight another topic here, that if you look into a highly vaccinated population group, like in Denmark or in Sweden, there could be pockets of unvaccinated population. As WHO has been recommending that the first booster dose need to be offered to population groups and the second booster dose to the vulnerable population groups of elderly, people with underlying disease conditions, and also those who are immunocompromised. It's extremely important that every country, irrespective of whether you are high or middle income or lower income economies, or you have a high vaccination coverage, it's important that we zoom down at the community level and find out people who have been left unvaccinated. Thank you.
Thank you. I think Dr. Smallwood has something to add.
Thank you, and fully just building on everything that Dr. Datta has just stated, I think the key point here is that both Sweden and in Denmark, vaccination uptake is very high in the population, that people who are targeted for additional doses still have the opportunity to get vaccinated if they need to, and that's something that we very much appreciate and continue to recommend as a personal measure, in addition to other measures that can prevent each other from either getting sick or passing our illness on.
Thank you so much for that. We have a follow-up from Donato at the Financial Times. Over to you.
Hey, thank you so much again for taking my question. Just to follow up on China, the PRC reported 2 deaths yesterday, I think, related to COVID. In your assessment, does this correspond to the truth? Thank you.
Dr. Kluge?
Perhaps I can take this question first. I believe that this would be better targeted at our team in our Geneva office, and I believe they'll be having a press conference tomorrow. But what I can comment on is that we are aware that the specific case definition for COVID-19 deaths that is used in China is very narrow, which means that they will be reporting against that case definition. And that is not necessarily the case definition that WHO has recommended countries adopt. However, what we have said throughout the past 3 years is that it is very difficult to compare deaths in one country to deaths in another. And that's something that we continue to emphasize, and we need to look at other metrics to look at really the population impact of the transmission of COVID-19. That includes hospitalizations, that includes excess mortality, it includes other data on indirect consequences of COVID-19 on the health of the population. And so for that reason, and that's why we continue to call on more information and more complete information, in addition to the adoption of case definitions that have been put forward by WHO.
Thank you for that, Dr. Smallwood. We have a question from Agence France Presse, Camille. She asks, how vulnerable is Europe at this time against COVID? Should masks and social distancing be broadly and strongly recommended? Dr. Smallwood.
I can start on this, and perhaps some of my colleagues might want to add, but what I'd like to say that is that coming into 2023, the European region and the Central Asian region are in fact in an extremely good position. We have strong population protection, thanks in part due to waves of natural infection that have occurred, but in greater part due to excellent general uptake in vaccination. We have, and that has led to the ability to loosen the widespread, very, very difficult social measures that we had to deal with in 2020, 2021 and coming into 2022. We also have really effective medical countermeasures that can be applied and distributed at the primary healthcare level that can prevent people from needing hospitalization. And we have really strong public health and health service infrastructure that can provide not only good surveillance of what's going on with the virus, but care to patients should they need it. But all of these systems require investment and continued support. And this is what we're calling for in the start of this year. In addition, there are many measures that individuals can continue to take, and these form part of the stabilizers that the regional director highlighted. So the continued seeking of vaccination, if you're eligible for it and part of a group that is called for additional doses. Continued use of medical masks in high-risk settings on public transport. Continued staying at home if you're sick, not exposing other people needlessly to infections. And of course, the continued use of other measures, protective measures like good ventilation in shared spaces and decisions about where we go and how vulnerable we are. And this is something that we don't need to repeat again. But these are things that protect against COVID-19, but also against other respiratory viruses that are really circulating in quite high levels at the moment across our region.
Thank you so much for that, Dr. Smallwood. Dr. Dutta has something to add as well to this. Over to you.
Yeah, thank you so much, Roy. Just to add on from where Dr. Smallwood left, I think it's critically important that we make use of the existing resources and the tools that we have our toolkit very effectively. That lies both for our member states who have done a tremendous job in offering the available vaccines to its population. But also the responsibility lies with the populations as well, as we have heard from our regional director who outlined those responsibilities at the start of this press conference. If we look into the vaccination coverage in our region, the vulnerability is very much glaring between the countries if you look into by income levels. When the vaccines are available in abundance, the COVID-19 vaccines, we are not talking about the situation what we have seen in early 2021. I think it lies on us that we reap the benefit of these vaccines so that the hospitals or the intensive care units in our region are not inundated again. This vaccine, yes, it is not designed to prevent infections, but we have seen reduction in transmission when the population uptake goes high. The benefit of the vaccine to prevent severe diseases and deaths have been demonstrated repeatedly by the real-time vaccine effectiveness studies that which have been published by several of our member states. So I think it lies on us now to ensure that we don't ourselves put the region into a vulnerability status just because we are not making use of the tools that we have on our hand. It's everybody's responsibility to make sure that we effectively use that. The other part I just wanted to highlight that COVID-19 alone is not the only thing that the health system in our region or across the globe they are taking care of. By not ensuring the health system is equipped to deliver the other routine services, we have talked about the essential medicines today, but if I can look into the routine vaccination coverage is also sliding in several countries of our region. So I think the health system has got enough of things on its plate already, and the vulnerability should not only be seen within the lens of COVID-19. It goes much, much wider. And I think it lies on us, both the member state as well as the populations, to make effective use of the available tools in our toolkit. Thank you.
Thank you so much for that. Dr. Muscat, you have something to add to that, please.
Thank you very much, Roy. And yes, as my colleagues have said earlier, the health systems in the European region at the moment are under unprecedented strain, not only because of COVID-19, but also because of other circulating respiratory illnesses. And we must also bear in mind that the European region has the oldest population, and therefore this has an impact on our health systems, on our hospitals also, because some respiratory illnesses that may not have a severe impact on a young person may, because of the frailty and other existing comorbidities, actually have a huge impact on older persons, and this in turn is impacting on primary care systems and on hospitals and on long-term care systems. And this is why we see a situation at the moment where a number of health systems in our region are struggling to cope with the acute admissions, particularly because of these respiratory illnesses that then present in older persons. And we don't want to be in a situation, but I fear that this may very well be the case, that we return to postponing or stopping elective procedures. Already our health systems are still struggling to cope with some of the backlogs that have been experienced during the peaks of the COVID pandemic. And if we are going to have to resort again to postponing, delaying, or cancelling treatment for cancer, for cardiovascular disease, or for orthopedic and rehabilitative procedures, this in turn is going to continue having an impact on patients and on the health workforce. We know that the health workforce is also passing through a very difficult moment, and our full empathy with all the health workers across the region who are in now the 4th year of the pandemic, still struggling to cope with the backlogs that have been built up, whilst we are seeing also these acute pressures on the health systems. So my appeal is not to forget all that we have learned during the COVID pandemic about simple things like keeping sick children at home and not sending them to school, about the benefits perhaps of combining and complementing remote working where possible, and definitely where there are symptoms of respiratory illnesses, about protecting oneself in crowded places, public transports and other closed and confined spaces, and particularly about taking additional protective measures when visiting older persons and persons who have chronic and existent diseases. Every single action by every single one of us can make a difference to stop our health systems from being overwhelmed.
Thank you so much for that. We don't seem to have any more questions online or through email. So before we conclude, may I ask Dr. Kluge to say something in conclusion?
Thank you, Roy, and thank you everyone for joining. I would like to pick up on the last intervention of Dr. Azopardo-Muscat on the health workforce. We are very concerned what we're seeing in the different health systems in the region. 23 March, we are convening the 53 Minister of Health and Director General's Chief Medical Officers in Bucharest in Romania to come up with a roadmap on the sustainable health workforce. We need to continue to invest and to nurture very much our doctors, our nurses, the informal carers, because without them, the health systems will not be able to function. Already the WHO Office for Europe published a report on the status of health and care workforce in the region. So what needs to be done is clear, but the worst which could happen is that now other policy issues dominate so much the agenda that investment in health and health systems, the health workforce, is dropping from the table, and we do not learn the painful lessons from the past. Thank you very much, and I wish you all a happy, a healthy, and a more peaceful 2023. Thank you.
Thank you so much for that, Dr. Kluge, and also a huge thanks to Dr. Smallwood, Dr. Datta, and Dr. Azopardo-Muscat. And thank you to all of you for having been with us for this first press briefing of 2023. Should you need any follow-up, please email us at eupress, that's eupress at who.int. Thank you so much, and we'll be back with you soon again. Take care.